Hi, I'm Dennis Suzara. I'm with Physical Medicine Rehab. I've been with Corewell Health now for about 10 years. I run the Amputation Clinic for all of Corewell Health West. The Amputation Clinic for Corewell Health West is a clinic that's multidisciplinary. It's housed in our 221 Michigan Multidisciplinary Trauma Clinic, where I work hand in hand with a hanger prosthetist, helping patients with amputees. One, not just get a prosthesis, but also learn how to use it, and make sure that what I like to say is get back to their lives. Everything that they were doing before they have their amputation, I'd like to get them back to what the things that make their lives enjoyable. So what I tell patients is, one, I like to start following patients about 6 weeks after their initial amputation, but I tell all my patients I see them for their whole lives. They are an amputee for the rest of their lives. They're going to need a good, great fitting prosthesis to do everything they want to do. Unfortunately, the prosthesis is made at a single point in time. It does not grow with the patient. It stays the same, and like a car, it breaks down over time. People, on the other hand, we grow older, we get fatter, we get skinnier, we lose weight, we get 6 inches taller. We change as individuals, and so having a great fitting prosthesis will just help them to do everything they want at various stages in their lives. Physical therapy is the bee's knees. I mean, it is the most important part of learning how to walk again. Think of you've been able to walk with 2 legs, and now you're missing your leg, but how do you get around? You've got this contraption on you. Having physical therapy is so important to learn how to walk again. And the metrics that we've been using help to show the improvement that these patients are making. I know you guys have been trained with the AmNo Pro and the AmPro, which are great things that we can use for data entry and data collection to say patients are starting at one point and then getting to another point. I think that's awesome to show, hey, the things that we are doing or you're doing as physical therapists are helping to make a huge impact on our patients' lives. As I'm sure all of you are aware, they've seen the AmNo Pro and AmPro about the K-score. So let's just go over what a K-score is. A K-score is a determination by the Centers for Medicare and Medicaid Services for levels of amputees. A K0 is someone who's never going to walk again. They'll be wheelchair bound for the rest of their lives. K1 needs a rudimentary leg, gets from point A to point B, and what I mean by that is like right here and then right there. Very short distances, very short household ambulation. K2 is flat land, they go to Meyer, and they're going to be in a scooter. And then a K3 is somebody who I think what we like to think of as most of our patients are people who are out there living their lives. They go running, they go hunting, they go fishing, they play sports. Everything that you and me do, or maybe you, not me, do on a daily basis because I'm sedentary. And then a K4 is a sport-specific leg, meaning a running blade that everyone's seen, hopefully on the Special Olympics, or one of my other patients, he has a leg to help climb mountains. So those are sport specific. So the reason why it's important is to say, okay, their first prosthesis, what level are we thinking? The second part of it is to say, okay, how are they improving? You can give them a K0 and then be seen later and, oh, look, they've jumped from a K0 to K1, because there are mitigating factors that occur. When you're doing it, they're in the hospital, they just had surgery, they're probably not feeling that great. As they get stronger, they might be able to graduate to a K1 and K2. And so having the K level tells us information about where they are, what kind of leg they need, and we can check on rate of progression. So that's why it's important. Part of the reason why I wanted to be a physical medicine rehab doctor was, what could I do to help people to get back to their lives, to improve function, because that's what PM&R does. Our job is to improve function. And so getting people back to their lives after something tragic has happened to them, I mean, that's great. Whatever I can do to help them, I will. Because as I've told them this, and excuse the pun, but I really just want this to be a footnote in their life. I want them to get back to living. Because that's what we all have a hard time doing sometimes. So helping these people, I think, and this is something I can do to help.